Good afternoon, everyone. Myself, Dr. Ghufran. I'm a physiotherapist and assistant professor in Paramedical College in Aligarh Muslim University. Today, we will explore a crucial aspect of healthcare, that is transforming respiratory medicine, that is inflammation, regeneration, and the use of electromagnetic therapy in respiratory care. Understanding how the body responds to the respiratory diseases and the potential of innovative treatments like electromagnetic therapy, it can pave the way for advancement in medical science. This therapy offers new possibilities by addressing inflammation and stimulating tissue regeneration, ultimately improving the patient outcome what we desire. Inflammation is a fundamental immune response which is designed to protect the body from infection and injuries. However, when the inflammation becomes chronic over a period of time, it can cause extensive tissue damage and impair normal lung function. So, respiratory conditions like in asthma, chronic obstructive pulmonary disease known as COPD, and pulmonary fibrosis, they all are characterized by the persistent inflammation leading to airway constriction, excessive mucus production, decreased oxygen exchange. For that, the conventional treatment primarily manages symptoms using anti-inflammatory drugs. We give bronchodilators, we give oxygen therapy, and so on. The list is so long. However, this method often fails to restore the damaged tissue or halts the disease progression. So, the regeneration word is the body's natural ability to repair and replace the damaged tissue cell. In the context of respiratory care, promoting lung tissue regeneration is an essential for restoring lung function and improving the quality of life for an individual with chronic disease, the primary aspect. While the lung have very limited regenerative abilities, medical advancements have identified strategies to improve this. One such approach is electromagnetic therapy, which has demonstrated the promising results in reducing the inflammation, enhancing cellular repair, and improving overall lung function. Before delving into this mechanism of action, let's first gain a conscious understanding of electromagnetic field therapy. So, electromagnetic therapy utilizes the electromagnetic field to influence the cellular process and enhance healing by affecting the electrical activity of the cell around it. EMF can improve the circulation, reduce oxidative stress, and modulate the immune responses finally. This therapy is applied in several forms like pulse electromagnetic field therapy, transcriminal. So, pulse electromagnetics uses the pulsating magnetic field to enhance the cellular regeneration and improves the pain. This therapy is widely recognized for its ability to boost circulation, promote tissue repair, reduce inflammation, and making it one of the beneficial aspects for respiratory condition. One of the another type is transcranial magnetic stimulation, which is primarily used for neurological and psychological treatment, and it has shown potential in respiratory care by regulating the autonomic control over breathing patterns and improving the lung function. Another type is magnetic therapy, which stimulates the cell and relieves the pain and inflammation, which is finally oftenly used in general wellness program. This therapy has been investigated for potential benefit in improving oxygen flow and reduce respiration. Coming back to the electromagnetic therapy, carefully directed electromagnetic field, it interacts with the biological system and promotes healing. There are several key mechanisms which contributes to the therapeutic effect of this particular modality. The one is anti-inflammatory effect. EMFs are known to influence the inflammatory pathway by reducing the production of pro-inflammatory cytokines such as TNF alpha, IL-6, and others, which are often implicated in chronic conditions. At the same time, they help enhance the production of anti-inflammatory cytokines, those so that to maintain a balanced immune response and potentially alleviating symptoms of the condition like arthritis and chronic pains and other chronic conditions. The second, it improves the blood flow and oxygenation. It is one of the significant benefit of EMF therapy, and it is ability to improve the microcirculation of the tissue. By improving the blood flow, EMF ensure that tissue receive an ample amount of the oxygen and the essential nutrients which accelerate the healing and support overall tissue function. This can be especially helpful in condition where circulation are being compromised or the oxygenation is the primary aspect of that particular tissue. provides the essential nutrients and promotes the overall tissue function. This is really helpful where the circulation is being compromised, like peripheral artery disease and following surgery. The third aspect is the cellular regeneration. EMF play a crucial role in stimulating the cellular regeneration. They promote fibroblastic activities and collagen synthesis, which are the vital for tissue repair and wound healing. This mechanism is especially beneficial in treating soft tissue injuries, bone injuries, and other conditions where the soft tissue and hard tissue is involved, and to improve the necessary function. The another aspect is the neuromodulation. At certain time of EMF can influence the nervous system and reduce the hyperactivity of the cell. In addition to the above mentioned mechanism, the improvement in the pulmonary function and tissue healing through pulsating electromagnetic stimulation can be attributed to the process of cellular depolarization, an important aspect. When the targeted electromagnetic field stimulates cell, they induce a depolarization of the targeted cell membrane. And this depolarization open up the calcium channel, causing an increased influx of the calcium into the cell. This elevated calcium level activates the colmalodin, which in turn trigger a cascade of signaling pathway that increase the cytoplasmic nitric oxide synthase. This enzyme, which is citric oxide synthase, produce nitric oxide. This nitric oxide involved for the vasodilatation, increase the widening of the vessel. This vasodilatation increase the blood flow of the targeted tissue and enhancing the oxygen and the nutrition delivery. Simultaneously, furthermore, the nitric oxide stimulate the production of cyclic guanosine monophosphate known as cyclic GMP, which activates a variety of the biological processes, including the transcriptional activation of the cell nucleus. And this activation promotes the production of essential growth factors and others, which facilitate the alignment of the cell around the injured tissue and helps in repair and regeneration of the tissue. Over the course of the days to weeks, these all mechanism keeps going on and restore the homeostasis in the affected tissue. The net effect is enhanced tissue healing and regeneration, driven by the improved circulation known as angiogenesis, the activation of the growth factor, and promotion of the cellular activities critical to tissue repair. By incorporating these cellular process, pulsating electromagnetic stimulation not only promote immediate improvement in the blood flow, but it also supports the long-term healing and restoration of the tissue, making it an effective therapy for the wide range of conditions, especially in respiratory condition, where there is a tissue is damaged and dysfunctional. As a result, the therapy not only addresses the immediate symptoms such as pain or inflammation, it also promotes long-term tissue regeneration, which helps in restoring the homeostasis over time. Given its capacity to influence multiple biological processes, the multiple biological processes involved in the healing, pulsating electromagnetic stimulation, it represents a promising non-invasive treatment option for enhancing tissue healing, improve pulmonary function, it accelerate recovery in variety of clinical conditions. To sum up, it is essential to recognize that a future healthcare professional, you have the opportunity to harness these emerging therapies to improve the patient outcome. It is very important as we continue to explore innovative treatments, the integration of the scientific knowledge and clinical practice will be the key to the advancing healthcare. Keep questioning, learning, and apply what you have discovered today, as the impact of these therapies can go far beyond what we have imagined. So thank you again for your time and attention. I'm confident that you will take this insight shared and apply them to your future endeavor, helping to shape the future of healthcare and contribute to the meaningful advancements in the patient care. So best of luck for your educational journey, and I look forward to seeing you at that accomplishment. Thank you very much.